right, yes, well, hello. My name is Mark Ritter. I'm part of the Department of Internal Medicine. So every couple of weeks or so, we put on these talks just for reaching out to the public about different issues. This week, we're discussing about oral and dental care and how it affects your health. So again, I'm Mark Ritter. This is my colleague. This is Dr. Young, excellent physician. We are just about to wrap up our training of residency here at the Marshfield Clinic. So I mean, it's meant to be a rather informal kind of a thing, so we can talk about, we have some things prepared, but otherwise if you have questions, concerns, bring them up. We'd be happy to talk about it, anything that seems to pique your interest. We're here for you. We are also here for our TV audience, but they cannot speak for themselves, so please comment to your local community center and we can try to address those issues. But in the meantime, I'll start off and talk about, why does dental health matter? I mean, the biggest things, at least, would be, certainly from quality of life standpoint, the ability of maintaining your current actual teeth without having other implements, things like that is huge. The ability of maintaining your good nutrition throughout life is exceptionally important. Along with this, teeth tend to be one of the traditional reservoirs for different infections. When I say reservoirs, they're places where they tend to hang out, and if we don't take care of them, they can be a source for bacterial infections, in particular problems with heart valves, and it used to be more traditionally thought joint replacements, which are big things, so many people are on antibiotics for such reasons. But those would be the biggest things. I wanted to kind of go through and just kind of talk in general about how dental health, how the pathology works, kind of in basic terms, like why we have the recommendations, which Paul will go over in terms of what the ADA recommends. So I think in general, the anatomy of the teeth, we have the outer part that's exposed, and then they kind of come deeper, and then they are around the gums, the gingiva, or what they're called, and then this attaches deeper into the to the tissue of the bone down below. There's the enamel on the outside, which is protective of your teeth. Then as you go in, you have the dentin, not that that matters as much, and then in the middle there's the pulp, which is kind of the blood vessels and actually the nerves, which cause a lot of sensitivity for people. These connect deeper into your jaw. Really, in brief, why we have the recommendations about, people tell you to brush your teeth, floss, this kind of business. The biggest reason is that we have a bunch of bacteria that normally live in our teeth. They're there all the time. The big one that we talk about is something called strep mutans. And what they like to do, they set up shop and they like to create what's called a plaque. We hear about plaque. And I'm going to talk about differentiating between plaque and tartar. This is actually like the crux of like why we care about teeth. Again, this is outside of our wheelhouse. Again, we're internists, we're not dentists. But if you have further questions, also refer to your dentist. But this is at least from our experience. So the formation of plaque. So your teeth, when you take in food, there's residual amounts of food left over. This is food for bacteria as well. They love to eat this stuff up, and they produce acid, which burns through your teeth. What they like to do, too, is they form protective layers, what are called plaques, over the course of actually, with even 12 hours, you'll have actually some formation of plaque. Even within a couple hours, you get some formation, which is why, in theory, it's actually beneficial to even brush up to every meal, but at least twice a day. The problem with plaques is that after a time, they become hardened. These are what are called tartar. The tartar buildup. So the idea is that if you brush your teeth on a regular basis, you'll reduce the plaque buildup and then in turn the tartar buildup. And the problem with the tartar buildup is that this hardened surface, this hardened outer shell of the bacteria that are now caked on your teeth, make it difficult for you to brush them off. So while if you do your brushing at a regular interval, every 12 hours, you reduce your likelihood of forming these plaques, which are then difficult to get off. However, no one's perfect. Maybe Paul's perfect, but no one's perfect at doing this, which is why we, on a regular basis, want to see a dentist as well to make sure if we have that tartar buildup. And that's why, so we don't recommend, I wouldn't recommend putting a pointy, sharp object into your mouth, but dentists, that's immediately what they reach for when you come into their office, is a pointy, sharp object in which they go and scrape off the tartar. So it's reasonable to do that at a regular basis to make sure that you're pulling off that tartar so that when your brushing is more effective, because if you fall behind, eventually you get this tartar buildup. Does that make sense so far? Do you have any questions about that? That'd be my synopsis about how dental health happens or how dental problems happen. So there's a lot of things that are involved in actually what constitutes like good health for your gums and for your teeth. In beginning of life and earlier in life, there's much more problems with cavities, and as we get older, what we're concerned more and more and more about is your gums. This is by the same process that the bacteria get in there, but this inflammation that occurs around your gums causes problems. Eventually, it can lead to the separation of some of the fibers that hold your teeth in place, and you can lose your teeth, and that's what ultimately leads to people to getting dentures. So in short, brush your teeth, visit a dentist on a regular basis, and Paul will go over this too, but this reduces that likelihood of the development of tartar, and then as a result, tooth decay and problems with loss of teeth related to gum disease. So that's one part of it. I wanted to talk a little bit too about, just from a medicine standpoint, things that you should be aware of. When it comes to dental health, it kind of is a yin and a yang, a chicken and the egg sort of a thing. Your systemic health affects how your teeth are. Your teeth also affects your systemic health. In general, people do a lot better if they have excellent dental care. It tends to be that they have better nutrition, which means you have a more robust immune system, which means you get sick less. Along with this, like I was saying, the problem with teeth, and if you don't maintain, especially that gum lining, every time you brush your teeth even actually can cause problems with shedding off these bacteria into your system, causing problems. So you reduce that likelihood if you take care of your teeth. But one thing I think I wanted to talk about, I think as pertinent to the community, is that there's a lot of things that occur with age and wisdom that can affect your gum and teeth health. In particular, one of the things I'm talking about is actually dry mouth. This is a terrible thing, and actually a large number of our drugs that we tend to prescribe to people will have this effect. And so it's important to talk to your doctor about that and being aware of issues with, in particular, the term we use is anticholinergic drugs, but that's fancy or whatever. But there are drugs that have this capacity to reduce the amount of saliva you produce. Saliva is protective to actually helping flush these bacteria away. And so this can affect your gum health as well. So be aware that there are medicines that we put people on that do cause this trouble. And it's something that's important to bring up to your doctor in terms of how this is going to affect how much saliva I produce. But also it's very important to talk to your dentist about this, because this will put you more at risk to developing gum disease. Along with this, the other thing I wanted to talk about is how other systemic diseases like diabetes and their ability to wound heal is significantly impaired actually as a result of, or if we have diabetes, our ability to keep our gums as healthy as we'd like is somewhat impaired. So again, this is something that will, that if you have other diseases, it's important to see a dentist even more regularly because your gums are at risk. Makes sense? Have any questions about that so far? That's kind of the short and dirty about these things. I think with that, I mean, that's at least my initial spiel. I think Paul had some other things about what the actual recommendations are about the American Dental Association. We can talk about some questions and things after too.
Yeah, thanks, Mark. Yeah. So some of the things that dentists recommend is brushing your teeth twice a day and flossing too. So the first part is brushing your teeth. That's the mechanical movement of trying to get all this gunk off your teeth that you ate food throughout the day, and stuff gets stuck in your teeth, on your teeth. And so there are a lot of barriers. The older you get, there are more barriers to brushing your teeth. For example, arthritis is a terrible thing. People's joints hurt, and they recommend brushing your teeth for about 2 minutes. And it's hard to keep your hand up and with this tiny toothbrush and start using it and brush every single day, twice a day. There's some things that they've recommended to get around this. One would be getting a larger handle. It's easier to hold. 2, a smaller head. They've also come out with these electric rechargeable toothbrushes, and with these electrical toothbrushes, it's not so much about the motion. You don't have to be doing all the scrubbing and mechanical work. These toothbrushes automatically rotate, and they do that brushing for you. All you need to do is make sure that that brush gets into the spots between your teeth, around it, and it'll automatically do it. So you just gotta move it around. And so that's one way around that. They recommend changing the tip of either your toothbrush or the head every 3 to 4 months. That's a very big thing. And they'll even have these blue indicators on the heads that will start to fade and go away when you need to replace the toothbrush, because no one says, oh, I bought my toothbrush in January and now I gotta replace it, it's March.
Yeah.
And so these little indicators are quite helpful for everyone.
I'm bad about doing that.
Yeah, me too.
Yeah.
I try to.
Yeah.
Another thing is flossing. So after you're done your brushing, flossing, because the brush can't get between your teeth. You get meat stuck between your teeth. You get all sorts of strings in there that you can't get out. And those are kind of nituses or places that bacteria can get stuck in and kind of grow. And if you're trying to hope that it just falls out by itself, sometimes it doesn't. So that's why flossing is very important to get in between those cracks. They recommend flossing at least once a day. It doesn't necessarily have to be in the morning, nighttime, but at least flossing once a day. Now there are these new things called water picks, or these new water systems that you use to floss. And the companies that make these places have shown studies to show that they're as good as flossing. When I asked my dentist about these new water systems, she says it should be used more as an adjunct, because even though it's stuck between your teeth, the water pick will shoot pressure at it, but it's still not that mechanical scrubbing against the surface that you want to make sure you get all that dirt off. It's just pressurized, and sometimes that food will still be stuck there, even after. And so she said it's a good alternative if people aren't flossing at all. Then yeah, of course, something's better than nothing, but nothing beats like manual scrubbing. So that's the mechanical part of it. And people over the age of 60, that start kind of when you start getting into the dentures. And so people will have dentures, false teeth, and things like that. These are not treated the same as teeth. You should not be taking your toothbrush and start scrubbing your dentures. It actually starts to ruin them, because toothpaste has abrasives in them. And that's not what you want for dentures. And that's why you're supposed to put them in the cups, and you put those denture cleaning things, and that's how you clean your dentures. That's very important, because if your dentures are dirty, you put it back against your gums, you start getting infections, and that's not sanitary, and that's why you need to make sure that you clean your dentures. They always recommend at least 4 hours of rest in a day of having your dentures. You shouldn't have them on for 24/7. And so teeth hygiene and dental hygiene, very important. Another thing they recommend is, as Mark was saying earlier, was to go and see your dentist regularly, at least once a year. Usually people see them every 6 months, but at least once a year. And that's one for that tartar that Mark was talking about that gets crusted on. The hygienist will go in and scrape that off, because once it hardens too much, there's no other way to get it off. You can't brush it off, and you have to literally scrape it off. And that plaque will just, or that tartar will keep building up otherwise. But there are more signs that the dentist can see of tooth decay and things like that before you start to feel it. Once you start feeling pain, it's probably too late. That means it's starting to hit these nerves, and that means they probably have to remove a tooth or drill into the tooth and put some antibiotics in the tooth sometimes. And you want to prevent from getting there, because prevention is always the easiest way of staying healthy. Dealing with the complications is always worse. And so by seeing the dentist, they can look at your teeth, make sure your teeth are clean. You at home are just kind of keeping it at a good level until you see your dentist next. And so they can avoid a lot of these problems and keep all your teeth. Because not everyone needs dentures. A lot of people actually can live their life without any dentures. It's all about keeping your teeth well maintained.
And increasingly, we're actually becoming more successful at this. The rate of dentures is actually falling about by 6% consistently every decade since like the 1950s. So we are making some good strides. I think this is good for our general public health, especially as we live longer. It's important to being able to maintain these things. So that's an aside.
Yeah. The addition of fluoride is another thing. Ever since they started putting fluoride in the water source, it keeps the teeth healthy. Unfortunately, with the scare of using tap water, we're actually fortunate enough to be one of the few countries in the world where you can actually open your tap and just drink your water. And so they put fluoride in your water, but the new way that people have been thinking is bottled water, which honestly a lot of the times is filtered tap water 7 times over. And you'll even see that the main ingredient on bottled water is tap water, and then they'll say reverse osmosis and whole bunch of things, but it takes that fluoride out of it. And so when you're drinking bottled water, you're not getting that fluoride inside your water. The other thing is people are starting to get these filters, Brita filters, and yes, it's good because they're contaminants in water, but sometimes these filters also take out that fluoride. And so if you're going to go the bottled water route, or if you're going to go the filtered water route, then you should be getting your fluoride from some other source. So your toothpaste, make sure that there's fluoride in them, or sometimes you can even get your dentist to give you the fluoride, whether it's the foam or they can paint it on sometimes, and that helps strengthen your teeth. And I guess the last thing would be for anyone who smokes, even though you may be 70 and say, I don't have much longer to live, it's still, it stains your teeth.
Yeah.
It's not good for your dental health. It's not good for your overall health. It's actually bad for your quality of life. And so as a physician or a dentist or just...
Or as a friend.
Or as a friend, generally, avoiding smoking would probably be best.
Yeah. I think that's the main things.
That's it for my quick tips.
Yeah, I think outside of that, I could talk a little bit more about other aspects with it. Some things that we think about too is having adequate nutrition for maintaining good gum health. In our country, it's fairly rare to kind of come across those things. Classically, there was things like vitamin C deficiency, which helps in maintain the integrity of the gums and the lining. Otherwise, most of the other things that usually tend to apply is for people that have like immune deficiencies. And actually, something to think about too is medicines that are taken for cancers can cause problems with gum disease. In particular, something called cyclophosphamide. Otherwise, patients with HIV and AIDS can actually have a lot of problems in terms of their teeth. I'm just saying not so much that you shouldn't take these medicines or that they're there for a reason, but if you happen to be having other systemic problems or have to require certain medicines, it's something to inform your dentist about and try to keep ahead of it. It may increase the amount of times that you would want to see your dentist per year. But I think that's the main stuff, honestly. So I think, in short, brush your teeth twice a day at least. Floss your teeth at least once a day. Visit the dentist on a regular basis. Drinking fluoridated water, and at the main, and then being able to check up on these things regularly enough so that we prevent problems before they become an issue, I'd say.
What about toothpaste versus no toothpaste?
As far as that goes, actually, I don't know if you've seen on the site or not.
You should.
Yeah,
you should be
use it,
using toothpaste. They put things in there. It's not just paste. There's stuff in there. There's abrasives which help scrub your teeth. There's fluoride in it. There's good stuff in toothpaste. Now, I couldn't find anything. There's this new thing, charcoal. People putting charcoal in their toothpaste. I've seen it at the grocery stores. Wow. I have no idea what that does to the addition to toothpaste. It makes your teeth black and it comes off, but that's all I know. There's supposed to be some medical property with it, but that I can't comment on.
Interesting.
But toothpaste, yes. Long answer. Short, yes. You should be using toothpaste.
What about if you have any missing teeth? Do they have to be replaced, or is your gum still just as good without that tooth there?
It's an interesting thing. Our teeth are designed to be opposed. So in terms of the physics even, so what will happen is actually it'll affect the other tooth on the other side. If you're having a missing tooth, say on the bottom, your top tooth will try to descend because it's not used, it doesn't have anything to abut it. It also creates odd places for where bacteria can build up. So usually the recommendation is to replace in order to actually maintain the adequate amount of pressure on the mouth and not to have reservoirs for bacteria to grow. Yeah. Which is, it's just very interesting. No, that's okay. So,
That's okay if they're not.
I mean, that's our spiel from a medicine standpoint. Certainly, you can study a lot more about these things. But I think from a public health standpoint, it's good to be mindful about these things. And yeah, that should be it. Anything else? Good.
Thanks for coming today.
Absolutely. No,
Thanks.
we could talk about other things too if you'd like as well. So
Yeah.
yeah,
You did a very good job.
yeah.
All right. Thanks.
Always outside of that, any other like health questions in general, things like that. I mean, we're not as prepared for other things, but yeah.
They're like picks rather than floss.
Yeah, actually, Paul was reading about that.
Yeah,
in
so that
particular.
actually is another option because floss, that's the original way of doing it. But even using these picks definitely work too, and that actually assists because otherwise you have to put half your mouth and half your hand inside your mouth and things. So those not water picks, but the pre-threaded floss are good options that you can also use.
They're like toothpicks, only they're plastic.
Oh.
Toothpicks. Oh, those brushes. Oh.
They're good for if you have a crown and you, to get underneath
I
that
see.
crown.
Yeah. So you're saying it's like a little thin piece of plastic that you kind of get. It's
Yeah.
like a really fancy toothpick. Is that the idea? Yeah. Yeah. 'Cause
Yeah, I didn't read anything about. I
yeah,
know I
'cause
did
the
talk
big-
to.
The biggest thing I think is getting that in between fully, whatever it takes in order to mechanically like really get on the sides of those teeth, whatever means necessary in order to do that. So I mean, yeah. So the traditional ones we're talking about are those ones that have like the expandable with a string across. But yeah, I'm not sure in terms of the brush.
Well, the dentist gives you samples, so.
Yeah,
I know.
Yeah.
I do get the samples from my
yeah,
dentist
yeah.
too, but one of my dentists tells me something different from my other. Sometimes they say use the purple mouthwash. The other one says use the green mouthwash. And I think in the end, using a mouthwash. Yeah, that's actually an interesting thing. So sometimes they tell you always rinse out your mouth with this very potent mouthwash to gargle it, and that helps with the hygiene. It actually does because one thing that they use to measure your dental hygiene is they look at these pockets. And so you have pockets between your teeth, and the deeper it is,
Yeah.
is kind of the worse it is, your dental.
You're talking about on the X-rays, you mean?
No. Even they'll measure it. They'll take these little like rulers in between. They'll say, okay, 3,
Oh.
7, 9, which would be terrible, but they measure those pockets. And even if you floss well, sometimes they'll recommend using these mouthwashes just to kill everything in your mouth. And those pockets actually start to regress, which is what they've seen.
Interesting.
Yeah. I guess I can comment on dental health in your heart too. Another reason of dental health is it can actually cause heart disease.
Yeah.
People who get recurrent mouth infections, there's a lot of vascular and blood supply in the mouth, and so what happens is if you don't, even if you brush your teeth, but if you get a lot of infections of the gums and the teeth, sometimes it goes into your bloodstream, and your heart is very fragile. It has these valves on it. And sometimes you can get these little bacteria that get picked up on your valves from your teeth, and those cause a lot of problems. In the worst case, you have to go in and get surgery to have these valves replaced. And so the other thing is when people have these valves replaced, and this is why it's always important to update your dentist about your medical health, any surgeries you've had, any heart conditions, any new changes to your health, is because your whole health is linked. And so they need to know, did you get a new valve? Because maybe you need antibiotics next time they do a dental procedure on you. And yeah, so there's a lot of studies that have been coming out that show that the better your dental health, the better your overall general health is, and it just makes sense. Good hygiene is good hygiene. It helps you live longer too and prevents a lot of issues.
Well, thank you for your time. It's always a pleasure to talk with everybody at the community center. So, we'll be trying to keep ahead about any other issues or things that people want to talk about. So please let us know. Otherwise, thank you for coming on in.
All right,
Thank you.
thanks.